Hey guys, today we're going to talk about migraine medication, when to take them, and why you're taking them wrong. Commonly we hear about, Advil migraine, Excedrin, Fuoricet, caffeine. Newer medications include things like Nurtec and Ubrelvy, but we also have medications that have been around for a long time for migraine, like sumatriptan or Amitrex, rizatriptan or Maxalt, and zolmitriptan or Zomig. These medications are meant to interrupt the migraine pathway before it starts, or I should say, before it gets too bad. Now, a lot of people don't know the migraine is starting. Now, it can be really hard to know when to take these migraine medications because we don't know what's going to be a bad headache / migraine or what's just kind of odd symptoms. But these migraine rescue medications are meant to be taken really early on. So don't be too afraid to take them if you feel like the first sign of a migraine is approaching. Now, some of you might say, well, what if I have a headache or migraine every single day? What am I supposed to do then? Well, I don't want you taking these rescue medications every single day because they can cause something called medication overuse headache or rebound headaches, as they're better known as. Oh, it's hot. Under a tree. If you were to tell me that you're getting a migraine every day and you can't take these rescue medications all the time, I would agree with you. And that means you need to get on a better preventative medication. Some of the signs and symptoms that you can get at the onset of a migraine is nausea, photosensitivity or light sensitivity, sound sensitivity, abnormal smells, dizziness, weird light that pops up in your vision like a kaleidoscope. We call this an aura. Also, people can have numbness and tingling that slowly progresses. And the point of this talk is I want you to take the medication, specifically the rescue medication, when these symptoms happen, before the painful syndrome really kicks in and starts kicking your butt. These medications will stop the spread of what we call cortical depression, which is what causes neural activity to give you the head pain and all of these other symptoms, which we call a migraine disorder. The disclaimer is that in order to prevent medication overuse headaches or rebound headaches, they don't recommend taking triptans like sumatriptan or rizatriptan more than 3 to 5 days in a row, Fuoricet more than 3 days in a row, or ibuprofen or Tylenol more than 14 days in a row, or else you put yourself at risk of rebound headaches and medication overuse headaches. We'll often use an anti-nausea medication such as Zofran, or a stronger one like Compazine. Does anyone here have a go-to for migraine rescue?